Welcome, dear listeners, to another enlightening episode of the Genetic Genius Podcast. I'm your host, Dr. LuLu, and today we embark on an incredible journey into the world of bioelectric medicine. Our guest today is a true pioneer in this field, someone whose passion for healing and unwavering dedication have transformed countless lives. I'm thrilled to introduce Guy Odishaw, a remarkable individual who wears many hats: CTO, NFP, healthcare, entrepreneur, and bioelectric medicine practitioner. He is a visionary founder of Bhakti Wellness Center, a beacon of integrative medicine, and co-founder of the very first integrative student health clinics in the United States, located at the University of Minnesota. But that's not all. Guy's commitment to advancing brain health has led him to co-found the Bhakti Brain Health Clinic, specializing in neuroimaging and neuromodulation, as well as the Minnesota Bredesen Clinic, focused on dementia, prevention, and treatment. And let's not forget his involvement in CerebralFit Brain Training, a groundbreaking venture in nutraceutical and electroceutical solutions. With over 30 years of clinical experience, Guy specializes in treating the most challenging cases of chronic pain, traumatic brain injuries, and psycho-emotional trauma. His unique approach to brain health combines cutting-edge techniques with the wisdom gained from over 20 years as a meditation instructor and a personal growth facilitator. Today, we'll delve deep into the realm of bioelectric medicine and learn how it has the power to transform lives. Join us as we explore the remarkable stories of individuals who've regained their sight, rekindled relationships, and reclaimed their independence, all thanks to the pioneering work of guest Guy Odishaw. So sit back, relax, and get ready to be inspired by the incredible journey we're about to embark on. This is Reconnecting with Life, a journey through bioelectric healing on the Genetic Genius Podcast. Hi, everyone. Welcome back to the Genetic Genius Podcast. I am so thrilled to have my guest, Guy Odishaw, here with us today. Welcome, Guy.
Thank you for the opportunity to come and talk with you and your audience. Looking forward to this.
You're so welcome. I'm so excited for our conversation today about bioelectric medicine. I, of course, love talking about all things that are a little bit off the radar, and that's one of our conversations today. And before we get all into that conversation, I'd love for you to introduce yourself. Tell us what your inspiration has been to where you are today and what kind of makes you tick. What's behind the scenes behind your life there?
Sure. Let's see where to start.
So, right.
I've been practicing for a little over 30 years. Started off, actually, if I go way back to my college years, was in pre-med, and then not really having a good time in that. And it wasn't that I didn't enjoy it. It wasn't particularly human. It was very much about the machine, the mechanism, and it just wasn't resonating for me. So just through a series of events, I ended up in massage school, which seems utterly obtuse, but it was just a chance for me to take a break and get away and have some fun, and what I thought was really just going to be a vacation at my mom's expense. And so that seemed good. But what I found out was that in the massage curriculum, in the experience of that training, was everything I didn't feel that the medical training was. We were dealing with people, and it was high touch more than high tech. And that kind of explicit contact with the subject versus the object was what made the difference for me. And so that started me off on a career that body work was where I started, and then soon traditional Chinese medicine and acupuncture, and then into craniosacral therapy, and then into bioelectric medicine, and then bioelectric medicine focusing primarily on the brain, so neuroimaging, neurofeedback, neurostimulation. So that's been the evolution over the 30 plus years. But then parallel to that, I've just had my entrepreneurial side. And so early on, I was working as a consultant and setting up integrative medicine clinics, and then eventually set up my own integrative clinic and built a model and grew it up to be one of the largest integrative clinics in the country. And now have started 3 brain health clinics. And so a little bit of a serial entrepreneur. And I love the business side. I love the patient contact, the one-on-one with clients. That still is the thing that drives me most days, is how to deliver care more effectively, more efficiently, how to reduce suffering and increase flourishing. Right? That's the
Mm.
thing that really excites me. And then the bioelectric side, which really for me unites these two passions that I had early in my life for people and technology. And usually you're either a people person or you're a thing person, right? And for me, I seem to have this, I want to work on both sides of it.
Mm-hmm.
And so it really has become a high touch, high tech, as most of my day is spent in direct contact with people, working with the subject within the person, but also the object of the body, and then using hands-on or verbal or technology to create a treatment plan. Yeah, it's been a fascinating journey, and a lot of it has just been who I am as a person. Again, had the pleasure of being able to make that my career as well, where that's not often that it works out that way, that one can kind of pursue the unfolding of the self and make that into a living at the same time.
Mm-hmm. Oh, thank you, Guy. I really love that kind of explanation of your growth through finding yourself, like from even starting massage school when you were younger. I did that myself, started my career in massage school as well. And it's a great way to understand the body, especially we all need that touch. So needed for us. And you're based in Minnesota, is that right?
I am. So our clinic is in Edina, Minnesota, and then home is just western suburbs of the Twin Cities.
Nice. That's great. I just spent 2 weeks in Minnesota in August visiting family, and I did a week in the Boundary Waters. So I love Minnesota. It was great, really fun. My husband's family is from there, not mine, but it was great.
Hey. And were you here in the midst of our heat wave, our 90
Yes, I
plus?
was. Yes, it was very hot, but it was very enjoyable as well. Yes. And so I love that Minnesota, when you were talking about like the tech and the touch, it reminded me, I felt like that kind of when I was visiting the city. It's like with the Twin Cities, this city vibe. And then it was the nature. It's like Minnesota also has that within itself. So I was thinking
It,
about that with you.
it does. And as odd as it seems, it's very progressive. Like I can't, it's hard for me to even say this, but Minnesota is a very progressive state. And,
Mm-hmm.
and I mean that in a particular way, not in a political way, but in this sense of moving forward on both sides of it, of the
Mm.
equation, in very much about people, but it is also very much about kind of technology. So it's about culture and society, both sides of
Mm-hmm.
that, and moving both sides forward in sync with one another. And that isn't often the case. You may have a state that where the technology drives things faster than the society can keep up.
Mm-hmm.
And so you have that, or places where that side of it is actually really suppressed. So the society isn't moving as fast as the rest of the country. And I really am pleasantly surprised that I landed in a place that has both sides of this. It's worked out
Mm-hmm.
well. Yeah.
Yeah, I agree. I love that about Minnesota. You nailed it right on the head there. It's a really good summary of the vibe of Minnesota. So if you haven't been to Minnesota, go visit because that's really cool. But maybe not in the winter. I haven't been there in the winter. My family wants me to come, but that's a story for our next episode when I go visit in the winter. Let's start talking a little bit about, you mentioned a little bit about bioelectric medicine. And I'd love for you to give us an overview about how it differs as well from a conventional medical approach. And then you also have a great clip, a video that you're going to play to explain it a little more for our audience. So if you're tuning in on YouTube and watching this, you can watch it live there, or we're also going to explain it a little bit also for the listeners who are tuning in the audio respect.
So the way I like to kind of start off the conversation about bioelectric medicine is say that there's, in a somewhat reductionist framework, we can think of ourselves, people, life, as chemical electric entities. Now we know we're much more than that. There's more to life than physics. But again, for this conversation, we're going to think about the chemical electric side of it. And
Mm-hmm.
we're all fairly familiar with chemical medicine, that's pharmaceuticals. And I think they've benefited us a great deal. we could even say on the nutrition side, most of the way we think about nutrition is on a chemical level. What nutrients am I getting from this to drive the chemical side of the reaction?
Mm-hmm.
But there's another part. There's the electrical side. And the main part of our allopathic medicine hasn't spent much time working on or thinking about dealing with the electrical side. Now, we do have a tradition in the West where the electrical side was more an equivalent to the chemical side, but it got eclipsed by the pharmaceutical process, and so has become the redheaded stepchild.
Right,
My apologies
totally.
to all redheads for that.
That's me. But that's okay.
Yes. Um, so what we're focusing on is the electrical side of this process, with an understanding that it is always both. The body's moving back and forth, taking electrical signals and turning those into chemical activities, and taking chemical activities and turning that into an electrical process. And so it's always both, and it isn't proper to privilege one over another. But what we're coming to see is that we've really missed out on a lot of potential in our healthcare by not taking on the electrical side with the same rigor as we have with the chemical side. But that's changing. It's about 10 plus years, more than that. But to talk about the body of research we're going to talk here today is we've got about 10 years where it has just exploded. And so the clip that I want to show is about 10, 11 years old. And then there's a direct kind of lineage of the research that has come from what they were able to show using a calcium ion channel dye, so that we would be able to physically see, so we could visually record the electromagnetic activity in cell division. And that's what we're going to look at. And we'll describe that as we go. But that has led to these just incredible discoveries on the bioelectric side, which we'll get into in more detail. So I'm going to go ahead and pull that up.
Great. Love it. Can't wait to see the video. Here we go.
So what we're going to be looking at here is there's going to be 2 frog embryos on the screen, and we're going to be looking at the one that's a little bit more in the lower left corner. It's a little brighter. And we're going to see what looks like anatomy. It looks like a face forming. But the thing to keep in mind is it's not anatomy yet. This is the electromagnetic template that will hold the intelligence as the cells divide and migrate into these zones. The magnetic field will become instructive for what those cells should become. So here we go. And you're going to start to see those bright white areas. So we got the beginning of the middle of the face, the mouth, gills, eyes, and then it's going to turn to the side, and you'll get a kind of a side view of an eye and a mouth. One more time. And again, the thing to keep in mind is this is potential. This is where the anatomy is going to be. This is an electromagnetic field of intelligence that will inform the stem cells what they should become.
Exactly. That next phase.
And so again, in the traditional systems, so Ayurvedic medicine, Chinese medicine, Tibetan medicine, you name the different forms of medicine, they have a concept of this. So chi, prana, things of that nature. And they've designed ways to interact with that intelligence rather than the parts. Like Western medicine is much more focused on the parts. We have a mechanistic view. If it's the genome we're looking at, we want to go in and edit the sequences within the genome. We want to push the parts around to make the machine the way we want.
Our machine.
Yeah, exactly.
Yes.
And if there's a tumor, we want to go in and cut it out. So we take a very mechanical view of the body and we engage with it in this way. On the bioelectric medicine, not that isn't possible. That is possible to have a mechanistic view. But what's emerging is a view that is more similar to the traditional perspectives or understandings, is that they aren't just parts, there's an intelligence.
Mm.
And so the way they say it is that we're dealing with agential material. In other words, a cell is an agent. It has intelligence in it. It's making choices. It's not just a dumb part. It's an intelligent part that has goals and can work towards those goals and can come up with novel solutions to how to reach its goal. And again, Ayurvedic medicine, there's an understanding of that. And so you're working with the wisdom of the body, you're working with the intelligence, or in one of the forms that I studied for about 9 years, biodynamic craniosacral, that's all we do,
Right.
is work with the intelligence in the system and not the parts. Right.
Exactly.
So you can have biomechanical craniosacral, where you presume to move the parts around and there's an alignment and a temporal bone should move like this. And if it's not, you make it. But in biodynamic craniosacral, if that temporal bone isn't moving the way we want it to, we would never presume to do an adjustment to force it to make it. We would work with the local intelligence to understand, like, what's going on that it isn't already doing its natural movements, what's needed to bring back the natural intelligence of the system. How do I, as a practitioner, help negotiate the hurdles around that what we call the inherent treatment plan, just the natural intelligence. That's what we're doing. And so what we see emerging now in kind of Western biological science is this kind of discovery, and in the discovery of it, a respect and a sympathy and the beginnings of a process saying, how do we work with this intelligence and not just try and push the parts around?
Exactly. Yes. And I love that you brought up too, like our innate intelligence, because one of the, in like naturopathic medicine philosophies is like igniting that innate intelligence within the body, right? It's always there. We know how to heal our body. We've known from the beginning of time, from birth, right? Or through all of our genetic makeup. And so when we ignite that electrical field, it's like that. I don't want to say superficial isn't the right word, but it's the unknowing within the knowing, right? It's like we used to like to have that like spark within, like you're lighting a match across the bookcase or the matchbox as a way to signal the cells to remember what it is like to heal, right? And so we're like, oh yeah, remember, if you, just in case you forgot, this is what it's like. And so I think sometimes people forget what it's like in their healing process, especially in a chronic disease state. I know you work a lot with that population. It's in like chronic pain, for instance, it's like the firing, it goes so far down the pain pathway that we have to we take the breath. Okay, let's go back to what's really firing within the system and help the system to remember from that electrical point of view. Yeah, this is how a cell communicates in the healing phase.
Yes, absolutely. And so again, on the bioelectric side, we have those two approaches. We can have a mechanical approach, which just says, oh, the cell voltage is too low. Cell voltage is too low. There's a number of processes it can't perform. And so we want to add in current and we want to raise this cell's voltage to 70 millivolts. And then, okay, now it has the electrical resources to do what it needs to do. So that's still a mechanical approach to it. Even though it's bioelectric, it's a mechanical approach. Whereas if we're into kind of working on the intelligence side, the information side, we're not really thinking about a direct intervention to a part. We are working with the intelligence, the unseen, right?
Exactly. Yes.
That's the difference. It's like intelligence isn't something you can touch. It's like culture. Culture isn't something you can touch. It's held in mind, in relation, the people, the field of relationship, right? The intersubjective space is where culture is held.
Exactly. Yeah. That's
So,
what we know.
yeah. So the same idea is when we're going to work on a bioelectric side with the intelligence, the challenge is how to get out of the parts mentality and work with this kind of unseen, untouchable, ineffable field And how do you engage with that?
Mm-hmm.
And so I'll give you an example. Just so one of the people that I follow the most is Michael Levin at Tufts University. And
Mm-hmm.
so for anybody who wants to just be amazed, go to YouTube, look up Michael Levin bioelectricity, and he has a bunch of talks. And I would say listen to his more recent talks as he's gotten better and tighter in his presentation, very, very nutrient dense.
Mm-hmm.
But as an example, so frogs don't regenerate. Right? So salamanders will regenerate, but
Mm-hmm.
frogs don't regenerate. But what he's been able to do with using bioelectric medicine is if he were to amputate a frog's leg, he can turn on the subroutine that says, grow a leg here. And then he doesn't have to micromanage. He doesn't say, I need to have some osteoclasts to make a bone, and then I need some muscles to make muscles, and I need ligaments, and I need those to be here. You couldn't, we don't have the ability yet to micromanage or 3D print that. That would be a
Not yet.
mechanical perspective. Not yet, but that would be a mechanical perspective.
Yeah.
What he's doing is leveraging the intelligence in the system that already knows how to grow a leg. The embryo came pre-packaged with how to grow a leg.
With the instructions.
In the instruction set. So what he's found is, how do you turn on the instruction set for a leg? He starts that and then gets out of the way and just lets a leg grow over a period of several months, and you end up with a frog with a normal, healthy, functional leg. And then they've gone on to do like a 5-legged frog or a 6-legged frog. And they just do that by turning on the algorithm, say, grow a leg here, get a normal, natural, functioning, wired into the nervous system, usable by the frog, 5th and 6th leg. Or growing an eye on a tadpole and saying, grow an eye here, and you get an eye. And you don't have to know how to build a lens of an eye or a retina of an eye, and how to build the nerve that will go and interface with the nervous system. You don't have to, you just turn on the subroutine and it does all of it for you. And sure enough, they've done tadpole with an eye on its tail that it can see with, wired into the central nervous system. And the brain can just go, oh, that's visual information. And never in the history of tadpoles was their genetics prepared to have an eye on the tail.
No.
But it does not throw off the animal. It just has an eye on its tail. Way you go. Right?
Love it.
So this is all speaking to, again, the intelligence that's innate in a system. It can just adapt to this and put it to use. Right? And so this is the side of bioelectric medicine that I think is most exciting, gets us into the regenerative medicine.
Yeah.
And so although they've been, very successful in kind of amphibian model, and now they've moved into a true mammal model with mice. And so far they've been able to get a mouse to regrow half a limb. And they're confident they will get all the way to the end and then eventually move into human trials. And so again, to me, this is the most exciting part about bioelectric medicine, is this ability to do what the traditions have posited as possible, but you don't see large scales examples of it, right? We maybe hear legend and lore, like when I was as an acupuncturist, and I just talked with a client whose husband was a legendary acupuncturist, and he would tell stories when he was training in Tibet of healers that could regenerate a limb. Right? And sure, I'm open to that being true.
Right.
But it isn't happening every day. Like, you can't book a flight to Tibet and go over there and have a finger regrown, right? Like,
that we know of. Maybe there's a special.
Not to say there isn't somebody doing it, but you can't go to Expedia and book that trip yet.
Not yet. No.
Not yet. Yep. And so, although the traditions have maybe at one time held the knowledge of the how to do it, now it's more, again, a little bit more of legend and lore than something that's being practiced and performed on a regular basis, right? But what we see happening as this is emerging in Western biological science is, what Western science does well is study a phenomena, understand the principles of that phenomena, and then apply those principles in a way that get you a predicted outcome. And a great example of this is what happened relatively recently, where we launched a space vehicle to go out and capture a part of the meteor that's coming in the direction of Earth,
Right.
and then capture a piece of that, fly back to Earth, drop it, and then fly off to go get another piece of another meteor.
Another sample, right?
Yeah. And so you say that's what science does well. If you think about the math that it took to calculate how to launch a rocket into space, release a space vehicle to fly, intersect with a moving object, and then take a sample of it without smashing into it, and then fly back to Earth and drop it in the target zone and then fly off again. That took a lot of math to figure that out.
Physics and math.
Yeah, that's what Western science does well.
Mm-hmm.
And that's what we see happening here is, so again, with Michael Levin's work, but a lot of people doing research like his around him now. So it isn't all just him. But one of the things they've shown is you can take a healthy animal and induce a tumor.
Mm-hmm.
You can make the tumor go away and make the tumor come back and go away. And what their understanding of cancer is you've got a tissue. That tissue has a local mind of how to be a liver cell.
Right. Yeah.
So there's a liver mind that is informing those cells how to be liver cells.
Right. Stem cell with the mind.
Yeah. Yep.
Yeah.
And so if you go in and you disconnect a subset of those liver cells from the mind, they revert back to being a single cell organism that are now only concerned about the cell, not about the organ.
Mm-hmm.
And they go off doing what cancer cells do, which is they eat more than their fair share and they reproduce faster, and that's a tumor. So then if you take that tumor and you reconnect it to the liver mind, they go back to being liver cells. Yeah.
Yay.
Yay. So this is what they're showing as a model and an understanding, but it isn't hypothesis. They can actually show it, reproduce it experimentally.
That's great.
Repeatedly to proof of concept. So again, there's this idea that, so he has his approach, what he calls TAME. It's a technological approach to mind everywhere.
Mm-hmm.
This idea that mind or intelligence goes all the way down.
To the very tiniest cell possible.
And then, so he stays in the frame of biology, but there are others who are studying this phenomena that would say it goes down to chemistry, molecules down to physics, down to quantum physics.
Electrons to atoms to,
exactly.
Yes.
That there's intelligence all the way down.
Yeah, there has to be.
Yeah, he stays within the frame of biology, but then looking at the intelligence that goes up. So from biology to psychology to sociology to philosophy, that there's an intelligence at play. And then what does that mean? And much of his research is really setting off some fascinating conversations in these other areas as people dive into the significance of what his research is showing. If cells are agents, so there's a cell has a self,
right?
But the cell is part of an organ, then what are the local politics there of that individual cell that is, become a liver cell, really, whether or not it wanted to? It's just what it's going to be, unless it gets broken away and then it reverts to single cell, and then we call that a tumor, and we try and
fix it, quote unquote fix it. Yes. Yeah, the body is so intelligent, right? It has so many different cells and the aspects, and I think people are really understanding the depths of that when it comes to their own healing, understanding, being able to understand, one, how their body works. I think a lot of people are just learning the physiology, right? Oh, okay, this is what this organ does, how it works. And then if they understand how that organ can communicate to other aspects of the body, then they start to understand at a deeper level, right? And then they can understand how that healing can take place from that communication level, from the hormones, the neurotransmitters, right? How can we change the communication to have a different output?
Yes. Yeah. An example of where might bioelectric medicine fit in, right? Just to do a little more practical and take it a little bit out of the abstract we've been talking about is, let's say a person has to go for surgery. Any number of clients, knee replacements, hip replacements, back surgeries, eye surgeries, you name it. But if I just take one of my folks who just had a knee replacement, so they're going to go in and have a very mechanical process done. I won't describe it, but if you ever look up what happens in a knee replacement, it's traumatic.
Yeah, I've seen the after effects, and when I worked on cadavers in medical school, so I can see the inside, like after it's happened. I was like, oh look, there's a titanium knee in here. It's so cool.
Yeah. Yeah. So the process of that intervention, although on the whole it's good, the process is very traumatic to multiple layers of the
Right.
anatomy and
Yes.
physiology. Right? So
Nerves and everything.
yeah, so person goes in and they have the surgery and they have a knee, and then the doctor sews you up and basically says, now go home and heal.
Goodbye.
So yeah, as necessary and beneficial as it was to have that, what has happened is a bunch of trauma.
Mm-hmm.
Now it's just go home and heal with some sense of it'll all take care of itself. And what bioelectric medicine, what I'm coming along and saying is actually we can augment and optimize many of those processes that your doctor has just said, now go do it. And it's just going to let it go the way it goes. There's interventions we can do here. Right? So one of the biggest complications from surgery is post-surgery adhesions. So if we can use bioelectric medicine to reduce the potential of the formation of adhesions.
Yeah, scar tissue adhesions. Mm-hmm.
Yep. Then we're decreasing the likelihood that this person is going to have that complication.
Right.
So that's one positive. The other side is the more we can help that tissue heal back to its original pre-scar, pre-trauma condition, the more likely that person is going to have a successful surgery. They're going to have fewer complications. The longer that knee replacement is going to last, the better their quality of life across multiple domains.
Right.
We're improving the outcome. And one might be simply that we can take most people after, say, a knee replacement, and within 24 hours, they don't need any pain meds.
Mm.
So even there, if we can just reduce pain meds, we all know the
side effects of opioids.
Yeah, the opioid epidemic and
right.
just the risk of becoming addicted by using them.
Yeah.
And so that's the biggest concern. Why would we care? We don't want the addiction side of it. But also we know that they don't optimize healing.
Right, exactly, because you're numbing your cell's communication, numbing
exactly.
the natural inflammation pathway.
Yeah, yep, exactly. So although they can improve quality of life by reducing pain, they do that by taking a little wind out of the sails of the healing process. So we get suboptimal healing. If we can manage a person's pain, but in ways that are accelerating the healing, then we've accomplished two goals. We've reduced their pain, but we've improved the outcome, not interfered with it.
Mm-hmm.
And so there's just layer upon layer of benefit to using bioelectric medicine post-surgery. And so what we actually do is I encourage my clients to use it pre-surgery to really optimize the tissue going into the surgery so that they are the most resilient to undergo this process, that the healing begins immediately because they have the more resources than they would if they hadn't. But then I like to start people with bioelectric medicine when possible. I want them doing it in the hospital.
Yeah.
And then we've got to navigate hospital politics because actually many hospitals won't allow it. There's a whole conversation to be had in situations, and I have had plenty of clients where we're able to do the bioelectric medicine post-surgery in the hospital.
Nice, that's
mostly
great.
to the fascination of the medical staff who've probably never heard of this stuff. They think it's a little weird, but who cares?
Who cares, right? Yeah, exactly. If it helps the healing.
What they get to witness is a patient that doesn't need medication on day 2.
Yeah.
And a wound that is healing many times faster than it would have normally. And that's the feedback we get when we're able to treat in the hospital. Doctors and nurses are just a little stunned by what they're seeing.
Because they're used to the regular healing protocol that they've laid out and seen in other patients, right? So they just, they're like, oh, I've never seen this before.
Yeah. So that's one place where we can take bioelectric medicine and just say, look, we're going to do a biomechanical intervention. And every reason was true and correct that we need to do this. Great. But then we can layer on top of that the bioelectric to optimize the outcome. And then there's the regenerative or the restorative, the revitalizing side of bioelectric medicine. So let's say when we're treating neurodegenerative conditions, so dementia, Parkinson's, but we could also say macular degeneration. So if we pick something like that, so a person has usually been on about a 15-year slope of deterioration, even though maybe a symptom hasn't presented, but we know that dementia, the process of dementia has been underway for about 15 years before a person expresses a symptom. So if we can catch them ideally before, but usually people wait until they have a symptom to
usually
get serious about treating
yes.
it. Yep.
Unfortunately, we've been trained in that. We're trying to retrain people to have a preventative and wellness outlook instead of waiting for a symptom to arrive.
Yes, absolutely. But what happens is most of the clients who are referred to or self-refer to CerebralFit for treatment, most of our patient population is dementia. Most of those people are a couple of steps into the symptomatic presentation.
Right. Some memory changes and things like that.
Yep. And in about 85% of the cases, based on our clinical outcomes, but also Dr. Bredesen's recent research that he put out, they're running about an 85% success rate at being able to, and what we say is slow, stop, or reverse. Right? And we never know in any one individual, will we get slowing? Will we stop it? Will we reverse it?
All individualized because of the brain damage that is happening through possible Alzheimer's, correct?
Yeah. And like, what's the source of it? Is it toxic? Right. Is it lifestyle? How progressed is it? How much resource and resilience does that person have as an individual? There's all kinds of factors, right? Like Dr. Bredesen identified 36, right? So there are 36 variables that we need to balance. So we just can't say up front. But of course, our hope is regenerative, reversing the condition. And we have plenty of cases to show that is absolutely possible and not an unrealistic endpoint. But we're able, through bioelectric medicine, so that would be something like infrared helmet to treat the brain, audiovisual entrainment to work on brain function and restore brain function, maybe a red or infrared nasal laser, again, to get the nasal laser gets light in the bottom of the brain, hippocampus, amygdala. The helmet gets light on the top of the brain, so the cortex. Right? Audiovisual entrainment is coming in for that middle space where we can get cortex, limbic system, autonomic nervous system there. And so what we're able to do is restore the function that is there, give the brain light as a nutrient that revitalizes a long list of processes, right? So we can increase mitochondrial activity, we can decrease inflammation, we can increase nitric oxide production, we can balance reactive oxygen species. It stimulates neurogenesis, angiogenesis, synaptogenesis, which is just to say, help regrow nerves, help regrow vasculature, help regrow synapses. And in a brain that is, the anatomy and physiology is losing the plot in multiple dimensions, it isn't effective to just try and treat one of those, right? To just change the vasculature isn't going to do it, or just reduce inflammation isn't going to do it. And what we find with bioelectric medicine is we can optimize 12, 13, 14, 15 essential physiological processes without a negative side effect, right? So it doesn't have the negative side effect of a medication. It's light. The body really knows what to do with light. We evolved in light. It's a nutrient. And so when we're able to revitalize the processes, again, what we count on is the intelligence of the body to do what it needs to do to move back to its set point. So again, we're not trying to micromanage. When we increase mitochondrial activity and you give the body more energy, we're not in there saying, I want you to put this energy here. It's like, the body is going to prioritize where it needs to use that energy for the healing process. And so it's highly individual, where this one system, its innate intelligence, will take this resource and apply it where it applies it, So the healing begins in different ways for each person. But this process, like when we're treating dementia, we don't presume a 1 month or a 6 months. We presume a lifelong treatment plan, right? That these things are nutrients. It's like eating a good diet, right? You don't
Right, exactly.
hopefully you don't say to your naturopathic doctor, like, oh, this is a great nutritional plan you set up for me. Can I do this for 3 months and then I can go back to eating
Or just one day.
Yeah. And hope your advice would be like,
Be longer term.
yeah, could we consider this as a lifestyle choice that you might decide to eat well for the rest of your life?
What a concept.
Yeah.
Yes.
And so it's the same on our side when we're
Right.
using devices. I consider the audiovisual entrainment, I call it the toothbrush for the brain.
Mm.
You should brush your teeth twice a day, every day, for as long as you want to have teeth. And same thing for the brain. You should brush your brain twice a day for as long as you want to have a brain.
Yes.
Just that simple.
Yes. Want to have a brain for a long time as we're living. Yes.
Yeah. Yep.
You mentioned the aspect of the helmet and some other pieces. Can you explain to our listeners, because we talked a lot about like how the behind the scenes, what the process is, but what is the application process? I think that would help to clarify some things. What are the different ways that you can actually apply physically with the actual bioelectric medicine?
Sure. So I can do like just a little bit of a demo here again for our people
let's do
watching.
it.
Yep.
Love demos.
So we have our infrared helmet, right?
Nice.
So this
Look at that.
a bike helmet
Yeah.
with an LED array inside.
Mm-hmm.
So we put our helmet on and then let's see, I'm going to put on my audio visual. Actually, maybe before I slip the glasses on, let's do this. We're going to put in the nasal laser.
Nice. Look at that. Yeah.
Yeah. So there's the nose lights up. It's me and Rudolph. Yeah. And then I could also, while we're at it, so ear lasers, great for hearing loss, tinnitus. So there we go. So now we've got my ear lasers in. Yep.
Great. Looking
and
good.
I've got my blinky glasses that I would put on. Those have the lights to do the visual entrainment. And then if I'm really, this is the part where the interview ends here. So I'm really going, I take my mouth guard.
Yes. No more talking. Mouth guard is in. Ta-da! Yeah, it looks great. I wish I was also doing it at the same time.
Yes.
Yes.
So this is a version of if we're treating a dementia, it could be again Parkinson's, dystonia, traumatic brain injury.
Right.
This is the way we would go in terms of the amount of technology we'd optimally have. Could we choose one of the devices? Yes. But if we really want to shift the brain on multiple levels right from the get-go to maximize the benefit of the treatment in the least amount of time, we're going to go with the helmet, the audiovisual entrainment, the nasal laser as our minimum optimum. And this, right? So this for 30 minutes twice a day.
Nice. Great. So you can do it in the morning, like when you wake up, and in the evening as you're settling down. What kind of effects does it have on the sympathetic and the parasympathetic nervous system?
Sure. I like to break the devices up in terms of their function in two ways that are more conceptual than actual. But I like to think about when we're affecting physiology and we're affecting function. So physiology is, say, for example, light. When we're using light, we mostly think about physiological changes, which is, again, the number one is increased mitochondrial activity, ATP production.
Right. Energy.
But earlier we were talking about the importance of cell signaling and information networks. Well, it turns out we may see here in the relatively near future that what mitochondria do that's most important is cell signaling. Right. So right now they're still given top billing for their energy production, but that's only because we're behind in the recognition and the understanding that they do a lot of cell signaling. So, for example, in the brain, when a brain wave is being propagated, so it's going to move from one part of the brain to another part of the brain for computation. So
Mm-hmm.
some computation was done in this region. Now it needs to go to another region to have some more computation done before it goes on to another one. That before that brainwave moves to the other region, that other region on a metabolic level starts to become more active. So circulation is increasing, mitochondrial activity is increasing, it's getting ready for the work that's coming. So some of the thinking is that signaling is actually being done by mitochondria.
That makes total sense.
Yeah. And so we're starting to see that they may play a much more significant role than just energy production. And part of it is the cell-to-cell signaling that they're doing. If, as we talked about earlier, that one of the problems that happens is a degradation in the information processing.
Right. The communication breakdown.
When we rehabilitate the mitochondria, we don't just get an improvement in energy, we get an improvement in the information processing. And that may actually turn out to be more important. So that's all on a physiological level, right? The decreasing inflammation, the increasing nitric oxide, that's all on a physiological level. From a brain function standpoint, I like to think about it more as what we were just talking about. When one region is talking to another region, that's a little bit more about function. And then we think of this happening in the brain waves. So delta, theta, alpha, beta 1, 2, 3, gamma.
Yeah.
Right? And eventually we will have an understanding that goes beyond gamma, but right now that's what we have to work with. And for memory, for example, we need a temporal area to talk to a frontal area in theta. And if that's happening, both memory encoding and memory retrieval is optimized. If those two regions are out of phase with one another, even a little bit, we get a degradation in memory encoding and memory retrieval.
Brain fog.
Brain fog, yes. So can we use neuromodulation to affect that so that we can resynchronize those two areas in the theta band and improve the functioning? And so the answer is yes.
Of course, yes.
And so that's what I mean by brain function. So
that's great.
Yeah. And so what we're looking at is which devices do which better. So the helmet and light does its best work on the physiological level. Can it do brain function? Yes. Is physiology related to function? Yes. It's a continuum. There's actually no separation. But conceptually, we talk about it because of where's the primary intervention happening. Right? So audiovisual entrainment, I think of as my primary tool for affecting brain function. But it's also true that it's affecting brain physiology because we know that when we use audiovisual entrainment, we increase levels of BDNF, which is brain-derived neurotropic factor. And so that's physiology. And so we know that these two come in pairs. But again, it's really about what's the main thing the device does. And then that's what we talk about, right? So the light for physiology and then audiovisual entrainment. So entrainment is about engaging function.
Reconnecting the brain communication pathway. Yes. Sorry, I cut you off right at the very end there. Yes. Yes, so true.
You're exactly right.
Yeah, that connection I think is so important. And I really liked how you brought the mitochondria into play because they're so important. And I think we're from the genetic perspective, from that DNA perspective, when that cell replicates, we want to have that mitochondria at like prime optimization, right? And so I love that the bioelectric medicine can then help with that specific piece, because then we can have a much better genetic code of communication, right? We want to have a cell that when it does replicate, that it's in this premium state, right? It's like your Porsche, right? You're like, okay, I want to have all my cells replicating like this. And then when we have a degraded cell, like you mentioned, when it's replicating then in this poor stage, we then move into that state of chronic health disease, right? Because our bodies can't really function on this, maybe a quarter of a cell communication, a quarter of a cell energy, right? So it sounds like a really great way to improve overall cell energy, but overall cell genetic code makeup.
Yes. And then I'll add a layer to that. I didn't mention earlier when I was listing off some of the functions, but one of my favorite functions of red and near infrared light is it optimizes the mRNA transcriptase process.
Mm-hmm.
So RNA is in there overseeing the process of cell division and rebuilding that genetic code for the new cell. So if we can optimize the RNA's function, it is more likely to make a better copy of the cell. In other words, the main thing is that however it has happened, somewhere along the line, we've acquired some genetic damage, whether through environmental toxins, or it could be the sun,
It
UV
could be
rays,
stress.
sun
It could be, there's
damage.
so many different things that
Yeah,
change
so
our
many different ways.
yeah,
Right? So
epigenetics.
we've expressed a genetic mutation.
Mm-hmm.
And then by adding in the light therapy, we increase the chances that when the replication process happens, that the process results in a better copy than a worse copy.
Right,
And
exactly.
again, this goes right to that point you were making is, can we affect, again, the answer is yes, we can affect the copies so that it suppresses the likelihood of a genetic mutation. So that's one, just suppress the likelihood of
Right.
a mutation being, but also increase the likelihood that a mutation that is already expressed is repaired.
Exactly. And
Yeah.
I think that's a big place that people are just starting to really understand, right?
Yeah.
It's like we have our genetic like blueprint, right? And that's, some people say that's not ever changeable, which I think we're discovering that might be not quite true, right? Yes. And then, but the other piece of it is when we do have that genetic damage or that change, that mutation word, right? So then we are able to come and repair it. And we're, again, speaking about prevention and wellness, there's so many different ways that we can do that. And I love that the bioelectric medicine is a stepping stone for that, because I think that's really the wave of medicine of the future, right? Learning how we can repair damage, because we're in a kind of a little toxic world. Unfortunately, we have a lot of areas that are not toxic, but we have things that affect us, just EMFs in general, right? There's so many different things. So if we're learning easy, simple tools that we can use to, like you mentioned, wearing the helmet in the morning and the evening as ways to repair maybe just basic overall daily damage, right? Then it can have the clock start to work backwards instead of working forwards.
Exactly.
Yeah.
Exactly that. Yes.
Yeah. The anti-aging and longevity becomes the forefront of the future. Yeah.
Yeah.
Um,
Yeah.
Go
So
ahead.
we've talked, I've talked a lot about regenerative brain, and that's where CerebralFit spends most of its time, whether it also in the mental health, anxiety, depression, same thing. But we also do bodies, and that could be something like fibromyalgia, irritable bowel syndrome, chronic fatigue, mast cell, or I'd mentioned the surgery. Somebody's going to
Right.
have
Yeah.
knee replacement. Or if we catch somebody soon enough, it would be, can we either prevent the knee replacement or delay it a long enough time that it make a significant delay in the time of that surgery. And so again, we use a lot of frequency specific microcurrent as a way to try and affect the electrical gradient at the cellular and tissue level to get those cells and tissues to do more of what we want them to do and less of what we don't want them to do. So can we optimize the environment, much like that, using microcurrent to optimize the environment post-surgery so that adhesions don't form?
Exactly.
Yeah.
Yeah. And I think that's really a great point that you made there too. It's like we can use different types of medicine to have really help on the preventative side to even prevent the surgery from happening maybe at all, which is a great standpoint, because it's not necessarily the outcome that's always the best for the patient, right? That's an option. It's an option that sometimes a surgeon will give that option, but that's not the only option in this scenario. And I think people are also understanding that too. There's a lot of different options. Listeners, make sure you look into all the options before you're cut into or move down a line, so to speak, because the other side of that, not all the surgeries are successful. And then the healing stage, it's great that there's things like bioelectric medicine that can really help the healing stage, but the healing stage can be traumatic for some people if the surgery doesn't go wrong, right? Oh, or right. So I had this great plan, and then, oh no, now I'm never going to be the quote unquote same again. And that can be really traumatic for a patient.
Absolutely. And I see a lot of knee replacements just because they're fairly common.
Yeah, very common.
Also, who my demographic is as on my orthopedic side. So I see
Yeah.
a lot of knee replacements. And even if I take somebody who would say their knee replacement was a complete success, many of my clients would be like, oh, I don't know why I waited so long. I should have had this done sooner.
Right. Yeah.
This is, and so they consider themselves to be a positive example of surgery gone well.
Yeah.
Their lived symptoms might be minimal. But what happens is when I get in, I actually start working on a tissue level. What we find out is that their tissue is incredibly unhealthy.
Exactly.
So
The inflammatory state of that tissue.
yeah. And the compromises in terms of what happened when the collagen fibers reformed is their collagen matrix is actually degraded. And so on the organism level, so on the person level, they think I'm fine. But then when we go down and we kind of stress that tissue, it presents a symptom. That shouldn't happen if it's healthy, right?
Exactly.
And so what I see is that in almost 100% of successful surgeries, the healing is far from 100%. Even though the person might say, I have no symptoms, that's not what happened. And so what does that mean? It means that system is chronically in a degraded state.
Exactly. Yeah. Cellular degradation. Right.
Yeah.
Yeah.
There's stressors that are eroding the resilience of the organism, the whole person. And so that just means that they're more likely to have some other adverse health event either sooner than they might otherwise have had, or at all. They may never have had it, but because of this drag on the system, it's going to pull them in a direction of a subtle movement towards disease. Whereas if that tissue was healthier and more resilient, it wouldn't be doing that.
Exactly. Yeah. That's a great point. I love that you brought that up because I think it's really important for people to understand that their body's been sending a message for a long time about some alarm that something has been going off, but maybe they weren't listening, or maybe they just would push through it, or maybe they didn't have the tools to address it. And there's lots of different reasons, right? But I love that you brought that up because when we do finally figure out like, oh yeah, something was not quite right, then we're given the opportunity for healing to be addressed. And that's a huge place for the world to be in, right? To have that acknowledgement, which is great. Guy, I think I could talk to you probably for an eternity, but I want to be conscious of our time. And so I'd love for us to start wrapping things up today. So first of all, one last question for you is, if I can't wait for you to answer this one. If you had an unlimited budget, what would you do right now to make the biggest impact on our planet?
So I love that question. My kind of fundamental takeaway after 30 some years of being in practice and again, running a large integrative clinic and working with a lot of professions and, like tens of thousands, probably hundreds of thousands of patients over all of those years that have come through the clinic. And not just that, but I've also along the side, I'm a longtime meditator. I've run classes on meditation for 25 years. So looking also at that kind of the personal growth side of it, not just the healthcare side, but again, the hardware, software sides of it. My net out after all of that is I think we would benefit from a more well-conceived cultural competency, like a better operating system as individuals to improve our operating system, but to have a cultural curriculum that presumes that doesn't stop with school.
Right,
Like
exactly.
right now, we kind of have, you go to preschool, probably high school for many people, and then maybe some college, where you're getting an education, but most of that education is cognitive academic or skills-based, but it isn't really a consciousness curriculum. It isn't a cultural curriculum, right? How to be a better person. It's how to be a better engineer or a better whatever, but it isn't about the subject themselves. improving how to be a more and more kind of expansive, inclusive subject, right? So a conscious process. And so I just think culturally, and this isn't just the US culture, it's fairly global, although some cultures have had historically, and they have pockets within them, where this is held as a primary approach and the most important thing to be done, that we have a cultural system for producing the most consciously evolved beings that we can, right? So there are some pockets around the world. And I would say what I would like to see that like global, but even if I just keep it more local, say to this country, is I would like to see us highly focused on that. So I think if we do that, it essentially eradicates most of the programs that you have that try and fill in the gaps for the missing of that.
Right.
And so if we focused more on that, much of where we spend our time and money, because we don't do that, we could let go of. Not 100%. Let's say even if it was 80%.
Yeah.
That would be a massive change for our society and where we all get to live our life. If we all got to live our life in a milieu of highly conscious people who were committed to an ever-growing increase in their own personal consciousness and the consciousness of others around them. So that's what I would do. Just that.
I love that. That's great. I'm definitely that's definitely a one that you're winner. Yes, we need that for sure. So listeners out there, make sure you make this one happen because we need it. Yes. Guy, okay, tell us your website, how people can find you. Tell us some of your social media so we can follow you and stalk you and find out what you're doing. And also you have a great call to action, a free consult for our listeners too. So tell us about all that good stuff.
Absolutely. Our website is www.cerebralfit.com. Cerebralfit.com. And there you'll find my direct email, my direct phone number. You can go online and book directly into my schedule for that free 15-minute consult, which is a great time for us to just talk over the high level basics of, is our program a good fit for you wherever you are in your health journey? And then there's a 45-minute consult where we really get into the meat and potatoes and do a good history, treatment plan, and what all that would look like. But the 15 minutes is a great place to start with, is this a good fit for you?
Exactly.
So with a free 15-minute consult, and then we're on Instagram at CerebralFit, and we're on Facebook, CerebralFit, and on YouTube at CerebralFit.
Easy to find, you guys. Easy to find you.
Pretty easy to find. And,
great. Wonderful, Guy. That's great. So we'll make sure we put all that in the show notes for our listeners. So if you're tuning in, you're driving in your car, listening to this great podcast, don't worry. You'll be able to easily remember that. CerebralFit, activate that brain. And you can look Guy up later. Thanks so much, Guy, for joining us today. I really loved our conversation and I can't wait to share it with our listeners and the world.
It's been a delight chatting with you.
Thank you so much for joining us.